If you have warts, skin tags, or those small bumps on your skin that bother you, worry you, or even make you hide your neck or underarms, today I want to explain how you can start managing them safely without putting your health at risk and by truly understanding what's happening inside your body. These skin growths, whether on your neck, under your arms, or on your back, often cause a lot of concern, especially because you may not know if they're dangerous or if they can go away. And let me be very clear with you from the start. In many cases, you can improve their appearance and even reduce them, but not in the way the internet usually promises. The right approach is actually simpler, safer, and far more logical than you've been led to believe. I'm Dr. Gabriel Mena, and after more than 2 decades treating patients, there's something I see over and over again, especially in people over 50, frustration. People who come in tired, who have tried everything, who have spent money on products that don't work, and most concerning of all, who have put their skin at risk using aggressive home remedies. I remember a patient who came in very distressed because she had several little warts on her neck. She had tried removing them using remedies she found online, and all she managed to do was irritate her skin. When I examined her carefully, we realized they weren't warts at all. They were skin tags. Just understanding that completely changed everything. Her treatment became much simpler, safer, and far more effective. That's why today I want to share with you the same method I use in my practice. This isn't about miracle cures or risky tricks. You won't hear empty promises here. What I'm going to teach you is a clear, step-by-step process so you can understand what type of lesion you have, why it appears, and what you can responsibly do to improve your skin health. If you truly want to stop worrying every time you look in the mirror and start taking control of what's happening with your skin, stay with me. Because when you understand what you have, you make better decisions, and that completely changes your results. And before we continue, if you find this type of information helpful, I invite you to subscribe and share this content with someone who might be going through the same thing. Many times, people close to us have these same concerns, and this video could help them more than you imagine. Now, before looking for any solution, there's one essential step that almost no one takes, and it's the most important of all. Pause for a moment and ask yourself, is this really a wart? It may seem like a simple question, but in my experience, most people who think they have warts actually have a completely different type of lesion. And this mistake is exactly why so many home treatments fail. Your skin is always sending signals, but you need to learn how to read them correctly. There are mainly 2 types of lesions that people constantly confuse: true warts and skin tags, also known as papillomas. At first glance they may look similar, but they are completely different. Let's start with real warts. A wart is caused by an infection, specifically by a very common virus called the human papillomavirus. There are many types of this virus, and in most cases they are not dangerous, but they do cause these skin growths. This virus spreads through direct contact, either skin to skin or through shared surfaces like public showers or towels. It's opportunistic. It takes advantage of small cuts or cracks in the skin to enter, and once inside, it causes the cells to multiply uncontrollably. That's what forms the wart. How can you recognize one? It's usually hard, rough to the touch, with an irregular surface, similar to a small cauliflower. Sometimes you may notice tiny black dots inside, which are not roots as many believe, but small blood vessels. They often appear on the hands, fingers, knees, or the soles of the feet. And something very important, because they are caused by a virus, warts are contagious. They can spread to other parts of your body or even to other people. Now let's talk about the most common case, and the one that causes the most confusion: skin tags. These are those small, soft growths that appear on the neck, underarms, groin, under the breasts, or even on the eyelids. They are extremely common, especially after the age of 50. Here's the key difference: skin tags are not caused by a virus. They are not contagious. You didn't catch them, and you can't pass them on. They are simply small, benign growths of your own skin. Unlike warts, they are usually soft, smooth, and slightly hanging, as if attached by a small stalk. Their color may be similar to your skin or slightly darker. So why do they appear? One obvious factor is friction. That's why they tend to develop in areas where the skin rubs constantly, like the neck or underarms. But there's something even more important you need to understand. In many cases, skin tags are related to what's happening inside your body, especially your metabolism. There is a very clear connection with insulin resistance. Let me explain it simply. Insulin is the hormone that helps sugar enter your cells to be used as energy. But when you consume excessive sugar and refined carbohydrates over time, your body may stop responding properly to that signal. As a result, your body produces more insulin than necessary. And that excess doesn't just affect your metabolism, it can also stimulate the growth of certain skin cells, promoting the appearance of skin tags. That's why these growths are so common in people who are overweight, have metabolic syndrome, or have type 2 diabetes. In that sense, these small bumps are not just a cosmetic issue, they can be a sign that something internal needs attention. To make this even clearer, there are other lesions that are also commonly confused. One of them is seborrheic keratosis, often called age warts. They are not warts and do not have a viral origin. They usually look like dark, waxy spots, as if they were stuck onto the skin. And then there are moles. If you've had one for a long time and notice that it changes in size, shape, color, or starts to itch or bleed, it's essential that you don't ignore it and get it checked. Understanding these differences is the first step, and probably the most important one, to making the right decisions about your skin. Because when you know what you have, you avoid mistakes and start seeing real results. If you have warts or those small skin growths and you're thinking about removing them on your own, it's essential to know how to do it safely. A wrong decision can lead to infection, bleeding, or scars that are difficult to correct later. When you truly understand what you have on your skin, everything changes. In simple terms, if the lesion is hard, rough, and appears on your hands or feet, it's most likely a viral wart. On the other hand, if it's soft, slightly hanging, and appears in areas like the neck, underarms, or groin, it's usually a skin tag. Knowing this difference is not a minor detail. It's the foundation for avoiding mistakes that can make things worse. Now I want to speak honestly about something I see every day in my practice: dangerous home remedies. There's a lot of information out there promising quick fixes, but in reality, many of these methods can do more harm than good. One of the most popular methods is tying off a skin tag with a thread. You've probably heard of it. The idea sounds logical. Cut off the blood supply so it dries out and falls off. But in practice, doing this at home is far riskier than it seems. You're interfering with living tissue without sterile conditions. Your hands, the thread, your skin, all of it can become an entry point for bacteria. I've seen patients with serious infections in the neck from something that seemed so simple. Redness, pain, swelling, even cases that required antibiotics. There's also the risk of bleeding. If the lesion is larger than it looks, it may bleed more than expected. And beyond that, the healing process is often not clean, increasing the chances of leaving a more noticeable mark than the original lesion. And there's something even more concerning. Are you completely sure it's just a skin tag? While it's not common, some more serious lesions can look similar at first glance. If you remove them at home, you lose the chance for proper medical evaluation. Another common mistake is trying to cut these lesions off with scissors, blades, or nail clippers. This is far more dangerous than you might think. Bleeding can be difficult to control, the pain is immediate, and the risk of infection remains high, even if you clean the tools with alcohol. I remember a patient who, out of embarrassment, tried to remove several skin tags from his underarm using nail clippers. He ended up with a significant infection, a lot of pain, and multiple scars. What he wanted to fix quickly turned into a much bigger problem. I also want to warn you about using acids without proper control. Vinegar, lemon juice, and other substances often promoted as natural solutions. The problem is that these products don't distinguish between the lesion and healthy skin. They can cause burns, irritation, and permanent marks. I completely understand the urge to get rid of these growths quickly. They affect how you look and how you feel. But as a doctor, my priority is your safety. And the truth is, these home methods carry far more risks than benefits. The right path is not the fastest, it's the safest. And now I want to show you what that path looks like. The method that truly works is not a trick or a miracle formula. It's a clear process based on knowledge and good decisions. It follows 3 essential steps: correct identification, controlled action, and knowing when to stop. The first step is to carefully observe your skin. Before doing anything, you need to analyze what you have. Ask yourself simple but important questions. Where is the lesion? If it appears in folds like the neck or underarms, it's likely a skin tag. If it's on the hands or feet, it may be a wart. Look at its shape. If it's soft and hanging, it's probably a skin tag. If it's hard, rough, and firm, it's more likely a wart. Check the color. If it's uniform, similar to your skin tone or slightly darker, it's usually benign. But if you see multiple colors, irregular borders, or a very dark tone, stop right there. Pay attention to changes. If it grows quickly, changes shape or color, or bleeds without reason, don't ignore it. That's a clear sign you need medical evaluation. And something very important, if you have diabetes, circulation problems, or a weakened immune system, you need to be extra careful. In these cases, the skin heals more slowly and the risk of infection is higher. Taking a few minutes to observe and understand your skin can make the difference between doing the right thing or making a mistake you'll regret. If you have warts or skin tags and you're unsure whether to treat them at home or see a specialist, this is where you make the most important decision, because doing it right can prevent complications, and doing it wrong can lead to consequences that are hard to reverse. If after carefully examining your skin you notice any warning signs, the safest decision is to leave it alone and consult a professional. However, if everything points to a small, stable skin tag or a common wart, and you are otherwise healthy, then, and only then, you can carefully move to the next step. This is where controlled action comes in, the safe method that truly works. And it's essential to understand this. A wart is not treated the same way as a skin tag. For common warts on the hands or feet, the safest at-home treatment is low-concentration salicylic acid, which you can easily find over the counter at pharmacies. It works gradually by dissolving the layers of the wart over time. It's not immediate, and patience is key. Here's how to do it correctly. At night, soak the area in warm water for a few minutes to soften the skin. Then dry it and, using a disposable nail file, gently remove the top layer of dead skin, without causing pain or bleeding. This step is crucial. Next, protect the surrounding healthy skin with a bit of petroleum jelly to create a barrier. Apply a small amount of the salicylic acid product directly onto the wart and cover it with a bandage. The next morning, remove the dressing and wash the area. Repeat this process every night. Consistency is what delivers results. If the surrounding skin becomes irritated, pause for a few days and then resume. When it comes to skin tags, the approach is completely different. And here's something many people don't realize. There is no safe, miracle cream to remove them at home. The real solution lies in understanding why they appear. In many cases, skin tags are linked to insulin resistance. That's why the most effective treatment is internal, not external. Adjusting your diet can make a significant difference. Reducing sugars, refined carbohydrates, sugary drinks, and ultra-processed foods is essential. Increasing your intake of fiber, vegetables, legumes, and whole foods helps your body manage blood sugar more effectively. And don't overlook movement. Regular exercise improves how your body uses glucose. Quality sleep and stress management also play a key role. This approach won't make existing skin tags disappear overnight, but it can prevent new ones from forming and improve your overall health. For the ones you already have and find bothersome, the safest option is still a quick in-office procedure. In just a few minutes, they can be removed cleanly, safely, and effectively. Some patients ask me about remedies like tea tree oil. My answer is simple. The scientific evidence is limited, and the risk of irritation is real. It's simply not worth it. I remember a patient who came in concerned because more and more skin tags were appearing on her neck. We not only removed them safely, but also worked on her lifestyle habits. Months later, not only had her skin improved, but she also felt more energetic and in better control of her health. That's the real goal. And now we come to the third step, one of the most important: recognizing your limits. You should seek professional care without hesitation if the lesion is on the face, genitals, or any sensitive area, if it hurts, bleeds, itches, or changes quickly. If you have many lesions, or if you have conditions like diabetes or poor circulation. And very important, if after several weeks of consistent treatment you see no improvement, don't keep pushing it. That's the moment to seek professional help. Everything I've shared with you today is not a trick, it's a smart way to care for your skin. You've moved from confusion and frustration to clarity and control. Now you know how to identify, what to avoid, and how to act safely. My goal has never been to give you a magic solution, but something far more valuable, judgment. So that the next time you see a lesion on your skin, you don't feel fear, you feel confidence. Because healthy skin isn't about perfection, it's about the decisions you make every day, calmly and with the right information. If this content has helped you gain clarity, I invite you to subscribe to the channel, turn on notifications, and share this video with someone who might need it. I'd also love to hear from you in the comments. Did you already know this information? Have you tried any home remedies? Remember, we upload new videos every day designed to help you take care of your health in a simple, practical way. And before you go, I invite you to pause for a moment, to give thanks to God for your life, for your body, and for the opportunity to learn how to care for yourself better. Because when you value your health, you begin to transform it. On this channel, Dr. Gabriel Mena is truly grateful to walk alongside you on your journey to better health. Thank you for being here, for your trust, and for taking conscious steps toward your well-being. I'll see you tomorrow with a new video that could make a real difference in your life.